This is part 3 of a 3-part interview we did with Rolando Mercado of Diversified Insurance Options for Seniors LLC, based in Blackwood, New Jersey. Rolando is licensed in New Jersey, Pennsylvania, and Delaware.
Okay, let's move on to Medicare Part D. Can you explain a little bit about what Medicare Part D is?
Medicare Part D is Medicare prescription drug coverage for prescriptions on an outpatient basis. It's available to all individuals within the United States that are Medicare eligible and have either Medicare Part A or Medicare Part B or Medicare Part A and Part B. Medicare Part D plans are specific to a certain service area. So you can only apply for a plan that's available in the area in which you reside.
And how does Part D work?
Part D is offered by individual companies, private companies that have a contract with the federal government. So you can purchase a plan, a standalone prescription drug plan by itself, unless you've obtained one through a Medicare Part C, the Medicare Advantage plan. Now, there are some group retiree plans that may also have a Part D plan. Key things to remember: Part D of Medicare is optional. You can choose a plan and enroll. Medicare will not actually do the enrollment for you. However, if you do not enroll when you first are eligible, then there may be a penalty later on when you do decide to enroll. Part D of Medicare, each of the plans have their specific formulary. Formulary is the listing of covered drugs that are covered on that plan's list. They must include a range of each of the therapeutic classes of drugs. In addition to that, there can be a monthly premium for the plan. There can be deductibles, co-payments, co-insurance, co-pays. And for individuals with limited income, there's a program known as Extra Help, as well as there are certain state programs that can be taken into consideration. Also, with Part D of Medicare, just as Part B of Medicare, your income may play a role as to how much you're going to pay for your Part D plan.
Are there any requirements to enroll?
To be eligible to enroll, you do have to have either Part A of Medicare or Part B, or Parts A and Part B, and you do have to live within the planned service area.
And what is the enrollment period?
The initial enrollment period is the 7-month period surrounding the individual's birthday. So, with the example that we gave all the way at the beginning of our friend Joe, whose birthday was going to be in June, he would have the 3 months prior to, so March, April, and May, to enroll in the plan for June 1st, or he would have June, the month of his birthday, and the 3 months that follow, July, August, and September. That would be the initial enrollment period for Part D of Medicare. In addition to that, there's the annual enrollment. The annual enrollment is on an annual basis, and it runs from October 15th to December 7th each year. That's the time frame when individuals can either change their prescription drug plan or they can enroll in one for the very first time. There's also what is known as special election periods for Part D of Medicare, such as when you're relocating from one service area to another one, or let's say you are losing your coverage from your employer and that offered prescription coverage, so you will no longer have prescription coverage, so you will need a plan, or you're going to be institutionalized. Those are some of the examples, along with what is known as a 5-star special enrollment period for plans that are rated by the federal government with 5 stars.
How should I know if I should enroll in Part D? What are the factors that I would want to consider?
Some of the things that you may want to consider at this point is, do I have creditable prescription coverage? In other words, do I have coverage that's as good as the Medicare prescription drug coverage base program or Medicare Part D? For an example, if you have an employer plan that's been offering your coverage, and then later on you don't need to at this point enroll in a Medicare Part D plan. However, later on you may actually have to do that and provide proof that you have had coverage. Another thing that you may want to take into consideration is, will that coverage end when you or your spouse retire? And how much is what's going to be the cost for your prescription drugs under that plan, taking into consideration the premium as well as the cost for each individual medication. So you also need to look at, do I have coverage that's equal or better than Medicare, or do I not?
So, what are some of the common mistakes people make when it comes to Medicare planning?
Considering the fact that there are different enrollment periods for enrolling in Medicare Part A and Part B, and there's different enrollment periods for Medicare Advantage plans, Medicare Part C, and there's different enrollment periods for Medicare Part D, all of the different enrollment periods vary, which means that most of the individuals go by what a friend has said. However, that may not be your specific situation. So you would want someone that's going to be able to look at your specific situation and say, okay, these are the rules that pertain to you specifically. Also, in understanding how Medicare Part D works, taking into consideration, I have some individuals, unfortunately, that enroll in a plan based upon the cost of the premium alone. And what should be taken into consideration is, number one, are my prescriptions going to be covered by that plan? If so, what is the monthly premium going to be? What is going to be the cost per medication? Is there a different cost if I use one pharmacy versus using a different pharmacy? And things like that are what needs to be taken into consideration. In addition, if you haven't enrolled in Part B of Medicare as of yet, and then you're considering enrolling in Part B of Medicare, or you want to see what needs to be done, there are forms that do need to be completed in order to enroll in Part B of Medicare. So all of that and a lot more is what makes this a little more confusing.
Yes, it seems that confusing seems to be a good word. Complicated would be another word and all. Can you give me just some examples of how you've helped some of your clients in some of their Medicare issues?
Sure. Just recently, I have a husband and wife that have been covered under a group sponsored plan and had questions. How do I obtain coverage? So the first thing is, they knew that they wanted to have a Medicare supplement plan. However, we needed to go through the process of getting them enrolled in Part B of Medicare. So that entailed forms that needed to be completed by the employer as well as by themselves, submitted to Social Security. And then once we have an actual date as to when Part B of Medicare is going to take effect, then we also need to take into consideration what their prescription drug needs are. So all of that is part of how we help clients out when we look at their specific needs and their specific situations. Now, the wife, when we looked at prescription drug plans, her needs were different than what her husband's needs were. So we were able to help them out in looking into plans that were going to meet their specific prescription drug needs, because Medicare plans are based on the individual, not a husband and wife. So individuals that have been sheltered under an employer-sponsored plan, when they come to Medicare, they find out it's totally different.
I know several years ago I took a course in Medicare planning, and I decided after taking that course that this is a complicated area, and I was thankful to have you to help walk me through all of this. If someone were to have someone to come by to talk about Medicare, what information would they need to have available for you?
The information that would be helpful, number one, whether it's an individual that's losing coverage and they're already over 65, or if it's an individual that is considering retirement, because at the present time I'm also helping clients that are considering retiring. We look at what their specific needs are. So if they have a listing, first of all, I'd like to see what coverage they've been accustomed to. So what coverage do they presently have? If it's someone that's already on Medicare, I'd like to see their Medicare card so that we can look at things such as the correct spelling of their name that's on their Medicare card, what's their Medicare claim number. However, as of April 2018, Medicare claim numbers will be changing. They will no longer be using an individual Social Security number or their spouse's Social Security number. So just want to make sure everyone's aware of that. That will be a transitioning period from April 2018 until December 2019. So I'd like to see their Medicare card. Also, I'd like to see what is the list of their physicians or what type of coverage they have presently that they're depending on. So they have coverage for their doctors and hospitals and specialists and prescriptions. So whatever it is that an individual is looking to have covered, I'd like to see that the first time we sit down.
Okay, well, we want to thank you for this time. And again, this is a very complex and complicated area. If someone wanted to talk to you further and had specific questions, how would they be able to get a hold of you?
Easiest way to get a hold of me is to call 856-794-1973, and that's my office number.
Well, thank you very much for taking the time today to go over this information, and we hope that you continue to keep yourself healthy so that you can continue to keep us healthy in giving us great information in Medicare. Thank you very much, Rolando.
Thank you for this opportunity, Phil.
Medicare has neither reviewed nor endorsed this information. Just as a reminder, this interview is not all-encompassing. For more information, please visit Medicare.gov or call Rolando to schedule an appointment for specific advice. The information covered in this interview is only as current as the date that we recorded it, which is June 23rd, 2017.
Securities and insurance services offered through Royal Alliance Associates, Inc., member FINRA SIPC.